Hello everyone, welcome back to our Fire Nursing Tutorial YouTube channel. In this class, we are going to discuss with MCQ questions. We'll start with first question. Magnesium sulfate is known as Epsom salt. Next question. Plaster of Paris is calcium sulfate. Plaster of Paris is the most commonly used material for immobilization of fractures. Chemically, the plaster of Paris is calcium sulfate. Which of the following advices is given to a client with plaster of Paris? All of the above. What is the major environmental concern related to the use of plaster of Paris? All of the above. What is the critical characteristic of plaster of Paris that makes it suitable for medical applications? All of the above. What is an important consideration when disposing of plaster of Paris waste? That option is D. It should be allowed to harden before disposal. Next question. A 30-year-old adult met with a motor vehicle accident 3 days ago and has been diagnosed with fat embolism syndrome. Identify the type of fracture that has occurred. Femur fracture. Next question. The first aid measure at the scene of an accident to minimize the immediate life-threatening systemic complication of injury to the long bone of the injured person is by. Right option is handling and transporting gently. Next question. This comfort device is used to support hips and thighs, preventing external rotation and keeping the feet in alignment in case of paralysis, fracture of femur and hip surgery. Trochanter roll. Next question. A 2-year-old child is placed in Prion traction for treatment of a fractured femur. The nurse develops a plan of care for the child. Which of the following is not a component of the plan? Right option is B, that is place the child supine with legs flexed slightly less than 90 degrees. Next question. A hospital acquired infection is defined as an infection that develops 48 hours or more after hospital admission. Next question. The most common portal of entry for healthcare associated infection is the urinary tract, often associated with catheters. The single most effective practice to prevent the transmission of hospital acquired infection is proper hand hygiene. Next question. When collecting a routine urine specimen for culture and sensitivity, the nurse should obtain a clean catch midstream urine sample. Next question. A patient develops a Clostridioides difficile infection. The most important transmission-based precaution to implement is contact precautions. Next question. The primary purpose of a timeout or specimen timeout before collecting a blood culture is to verify the patient's identity and the correct specimen labels. Next question. A nosocomial infection that is resistant to multiple antibiotics such as MRSA, that is methicillin resistant staphylococcus aureus, is primarily a result of the overuse and misuse of antibiotics. Next question. When collecting a sputum specimen for culture, the ideal sample is. Right option is B, that is sputum coughed up from the lungs, often after debreathing. Next question. The chain of infection model includes all the following except a portal of reimbursement. Next question. For which type of specimen collection is it crucial to maintain anaerobic conditions? Right option is C, that is wound culture from a deep tunneling wound. Next question. A patient with active pulmonary tuberculosis should be placed on airborne precautions. Next question. When collecting a blood culture, the most critical step to prevent contamination is. Performing a meticulous skin antisepsis with chlorhexidine. Next question. A fomite is defined as. An inanimate object that can harbor pathogens. Next question. For a wound culture, the best sample is obtained by. Collecting pus or tissue from the deep, cleanest part of the wound after surface cleaning. Next question. The most common hospital acquired infection. Catheter associated urinary tract infections. When collecting a stool specimen for Clostridioides difficile, it is important to send the specimen in a sterile, leak-proof container and ensure it is processed quickly or placed in a transport medium. Next question. Standard precautions are based on the principle that all patients are potentially infectious. The correct order of steps for drawing a blood culture is. Right option is B, that is apply tourniquet, palpate vein, clean side, draw blood. Next question. A patient on contact precautions for a draining wound infection requires a chest x-ray. The nurse should. A right option is B, that is cover the draining wound with a clean dry dressing and inform the radiology department of the precautions. Next question. A 24-hour urine collection requires the nurse to. Discard the first void and then save all urine for the next 24 hours. The primary reason for using a sterile sealed specimen container for a urine culture is to prevent contamination from the environment after collection. A patient with a productive cough and a fever needs a sputum culture. The best time to collect the specimen is. First thing in the morning. An hydrogenic infection is one that right option is B, that is caused by a diagnostic or the therapeutic procedure. When labeling any specimen container, the minimum required information includes patient's name, date of birth, and medical record number. Next question. The most important intervention to prevent a ventilator-associated pneumonia is. Keeping the Head of the bed elevated to 30 to 45 degrees. Please like, share and subscribe to our YouTube channel for more informative content. Thank you for watching.